We will begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thank you so much for joining us again today. As many of you know, yesterday I announced that we would be issuing a safer at home order today. Late last week, I said I didn't think we'd need to go to a safer at home order. That's something I didn't think that we needed to do, and it's not something I wanted to do. But I've said all along in this process that this is a fluid process and that I would listen to the science and public health experts to make the best decision possible for the people of the state. And that's why I made the decision that I did yesterday to have Secretary Palm issue today's order. The bottom line is that COVID-19 has been and continues to be a rapidly evolving situation, sometimes changing by the hour. That means that sometimes our responses have to change as we have more information. And if you're going to prevent and manage the further spread and ensure that the healthcare workers and the system aren't overwhelmed, then that means we have to be willing to act as quickly as we are able to do to keep people safe. And that's what's always going to be the bottom line for me, keeping people safe. Our deepest sympathies are with the families and friends of those who lost someone to this virus. I was struck by the profound statement from a family member of one of the deceased. This is a quote from his obituary. "We ask you to be serious about COVID-19. Please do not panic, rather educate yourself and your family. Please do not blame or shun, rather be supportive and compassionate, especially with the people who have tested positive for this virus." Now, I recognize that a lot of folks out there have had questions about the order, and I recognize this is a difficult time for our state and our country. At the end of the day, folks, we are all in this together. And during the most difficult times, we are called upon to remember our Wisconsin values of kindness, compassion, empathy, and respect. So to that end, I'm going to continue to ask for your help, not only to remember these values, but to do your part to keep our friends, our family, and frankly, most importantly, our healthcare workers and communities safe. We need folks to take the safer at home order I signed today seriously. Folks do not need a special permission to leave their homes. You can still go outdoors, walk your dog, go to the doctor, go to the pharmacist, and get other and groceries, and get all the supplies that you need. But this is important. We need to have folks limit their interactions to the same people, not different small groups. Shrinking your circle of interactions will help prevent the spread of COVID-19 to make sure our healthcare system doesn't become overwhelmed. Unfortunately, that means no potlucks, no play dates, and no dinner parties. And if you have to leave your home, please stay 6 feet away from other people. As I also mentioned yesterday, some businesses will continue to be allowed to operate. So no need to run to the grocery store and hoard food. Healthcare operations, grocery stores, pharmacies, gas stations, banks, critical infrastructure, and businesses that ship and deliver groceries and foods and goods directly to residences, among others, will continue to stay open. Over the past several days, we've been working with public health experts, local governments, stakeholders, business leaders, to determine how we can best keep folks safe while continuing to provide the essential services and keep our economy strong. If you have questions about whether your business is essential or non-essential, please review the Safer at Home order. And if you have any additional questions, please visit wedc.org/essentialbusiness for other details. In addition to our Safer at Home order, we are also working to ensure that our healthcare and essential workers have access to child care in Wisconsin. Last week, my administration convened a broad group of stakeholders to determine what child care options were available to healthcare workers and what child care needs existed within the healthcare community. Over the past 48 hours, we've begun connecting the dots for those folks with child caregivers. We also put into motion the plans for new on-site child care facilities. I fully expect the coming weeks to see these operational. These are operational in areas of high demand. Now, I just have to go back and talk about one thing in particular. All this is about making sure that our healthcare workers, our emergency responders, and others that are helping save lives and prevent this virus from expanding to do their work. It is very important. And I also want to thank some people that are helping us in doing that. So I want to acknowledge a few key partners: the Wisconsin Hospital Association, the Wisconsin Early Childhood Association, Supporting Families Together Association and Registry, and staff and leaders from DHS and DCF. I want to give a big thanks to the child care providers who are keeping these kids healthy and safe and adapting to this rapidly evolving situation. On a separate note, I'd like to thank the Wisconsin Dental Association that has offered personal protection equipment, which includes 20,000 masks, 25,000 gloves, and 1,700 gowns. We are coordinating with the Wisconsin Emergency Management System to arrange for the transportation of this material back to a Madison warehouse for redistribution to facilities in need. So I want to thank all the folks who are generously working to help us get the supplies we need to our healthcare workers and systems across our state.